In this tutorial I'll be talking about the muscles of the gluteal region and how they act on the hip joint. So the hip joint is this joint between the head of the femur and the acetabulum of the pelvic bone. So it's this joint here, and this joint is quite a stable joint and it has several movements. So at the hip joint you get flexion and extension. So flexion is bringing the thigh up like this. Extension is bringing the thigh bone, the femur, back like this. You get abduction and adduction. So abduction, bringing the femur away from the midline. Adduction, adduction, bringing the femur towards the midline. And then you get medial and lateral rotation. So medial rotation would be rotating the femur inwards, and lateral rotation or external rotation is rotating the femur outwards. So you get these movements at the hip joint. So the gluteal region is this region between the crest, the iliac crest, and the gluteal fold. So the gluteal fold defines the lower limit of the buttock. So I'll just switch over to, so it's this, the gluteal fold is down here and you've got the iliac crest here. So it's this posterolateral region, the gluteal region. So I'll be talking about these muscles, the muscles in this muscle group. So what these muscles do is they extend, abduct and laterally rotate the femur. And it's helpful to think of these muscles in terms of deep and a superficial group. So I'll first talk about the superficial group and then I'll move on to the deep group. So the superficial group are these the larger muscle group. You've got these three large muscles, the gluteus maximus, medius and minimus, and these muscles abduct and extend the hip. And then you've got the deep muscles, which are much smaller and they're lateral rotators of the hip. And you've also got this muscle which lies more laterally, the tensor fasciae latae, which is also part of the superficial group. Okay, so just starting with the superficial muscle group, we'll take a look at the four muscles. So first we've got the tensor fasciae latae. So this muscle originates on the iliac crest, just behind the anterior superior iliac spine. So just show you that. So this is the pelvic bone, and you've got the anterior superior iliac spine, and you've got the anterior inferior iliac spine just there. So the tensor fasciae latae originates just behind ACIS and just anterior to the tubercle of the iliac crest, so this little bit here. So it originates just on this bit here. So the tensor fasciae latae inserts onto this band of fascia which runs down the lateral aspect of the leg. So this band is called the iliotibial tract because it runs from the crest of the ilium, so from the tubercle of the crest of the ilium right down to the tibia, so iliotibial tract, and the tensor fasciae latae inserts onto the anterior aspect of this band of fascia. So what this muscle does, the tensor fasciae latae, it stabilizes the knee in extension, and it also stabilizes the hip joint. So it acts together with the gluteus maximus, which I'll just come on to. So it stabilizes the femur in the acetabulum, and it also stabilizes the knee joint in extension. So that's the tensor fasciae latae, and it's innervated by the superior gluteal nerve. So the gluteus medius, minimus and tensor fasciae latae are innervated by the superior gluteal nerve, but the gluteus maximus is innervated by the inferior gluteal nerve. So this is the next muscle I'll come on to. So this is the largest muscle of the gluteal region. So this muscle has this kind of rectangular shape, this quadrangular shape, and it has this broad attachment on the ilium and also the posterior lower parts of the sacrum and also the coccyx. So it has this broad attachment, and it has 2 points of insertion. So it inserts onto the back of the iliotibial tract and also onto the gluteal tuberosity on the femur. So let's just remove some of these muscles here. So you can see it inserting on the back of the femur, and it inserts on the gluteal tuberosity, and it also has this insertion on the posterior aspect of this iliotibial tract, so this band of fascia. So what this muscle does is it extends the flexed thigh, so it draws the thigh back like this, and it also stabilizes the hip and knee joints because of this attachment it has to the iliotibial tract. So this muscle is the gluteus maximus, and it's innervated by the inferior gluteal nerve. So next we've got the gluteus medius and the gluteus minimus. So the gluteus medius lies between the minimus and the maximus, and this is a fan-shaped muscle, and you can see its origin on the ilium here. So this muscle overlies the gluteus minimus, has its attachment on the ilium, this broad attachment, and it inserts laterally on the greater trochanter. So what this muscle does is it abducts the femur. So when it contracts, it abducts at the hip joint. So just under the gluteus medius you've got the gluteus minimus. So as the name suggests, this is the smallest muscle of the gluteal region. So this muscle also originates on the external surface of the ilium, and it originates, it inserts anterolaterally on the greater trochanter. So it also abducts the femur at the hip joint. So both the gluteus medius and the gluteus minimus are innervated by the superior gluteal nerve, along with the tensor fasciae latae muscle. So these are the four muscles of the superficial group. And then next we've got the smaller deep muscles, which are lateral rotators of the femur. So I'll just talk about. Okay, so the next part of this tutorial is on the deep muscles of the gluteal region, and these are small little muscles which mainly act as lateral rotators of the femur at the hip joint. So unfortunately this model here isn't actually that accurate, so I'm going to do a bit of flicking between diagrams and this 3D model just to try and explain things clearly, because I used to find this quite a tricky sort of area, because there's a lot of small muscles with precise origins and insertions. So I'll just talk you through that now. So these muscles obviously lie under the gluteal maximus, the gluteus maximus, medius and minimus, and these muscles laterally rotate and abduct the hip joint. So I've just switched over to one of these old diagrams which shows things a bit more accurately. So we're looking posteriorly at the same view we were just looking at. So this is the cut gluteus maximus, medius and minimus, and we're looking at these group of muscles here which lie under the superficial group. So I'm going to work from superior to inferior, talking about the muscles. So I'll quickly cover them first. So the most superior one is the piriformis muscle, and this originates on the anterolateral surface of the sacrum, between the anterior sacral foramina, and it inserts on the greater trochanter of the femur. Below that you've got the gemellus superior. Below that you've got the obturator internus, and this is the tendon of the obturator internus because the actual muscle lies a bit more medially, and I'll show you that in a second. So then you've got the gemellus inferior. So in Latin the word gemellus is twin, so these muscles are little triangular muscles, and they lie above and below the tendon of the obturator internus. So all these muscles are inserting onto the greater trochanter. So the gemellus superior actually originates near the spine, the ischial spine, and it inserts obviously on the greater trochanter, but also along the border of the superior aspect of the obturator internus tendon. So the gemellus inferior inserts along the inferior aspect of the obturator internus and tendon, and also at the greater trochanter. And these three muscles, the obturator internus together with the gemellus superior and inferior, insert together on the greater trochanter. And what these muscles do is that they laterally rotate the femur, and they can also abduct. So the most inferior muscle is this muscle here, this quadrangular shape, so it's called the quadratus femoris muscle. And this muscle originates on the lateral aspect of the ischium, just anterior to the ischial tuberosity, and then it inserts on the femur between the greater and the lesser trochanter. So this muscle purely laterally